Hello everyone, I'm Dr. Shruti Agarwal, practicing neurologist and epileptologist at Critical Hospital Juhu and All Cure Super Speciality Hospital Jogeshwari. Today I'm here with you to discuss the right way to describe the seizure and to record it, as it is of prime importance in our day-to-day practice. There are various types of seizures and it is important for a doctor to know what kind of seizure you're getting to prescribe you the right medicine. The doctor may not see your seizure, or he or she has to rely on your description or your eyewitness's description or the information that you have got from your eyewitnesses who are not present in the clinic at that time to talk about the description of the seizure. The better you are in describing the seizure, the easier and perhaps quicker it will be for the doctor to start bringing the seizures under control. It is possible to have more than one type of seizure, and if you think that you have more than one kind, then be sure to describe each kind of seizure separately and record the type if possible. When watching a seizure, try to note that what happens exactly before, during, and after the event. Write down what happened as soon as you can. Accurate recording of seizure descriptions by witnesses is an important part of managing a person's epilepsy. There are no definitive diagnostic tests for epilepsy or for determining a particular seizure type. Therefore, doctors rely on accurate accounts and recording of frequency and severity of seizures to make a diagnosis and guide the treatment. Determine potential triggers and differentiate different types of seizures or new seizure presentations. So records should be kept in the form of written descriptions noted in a diary or log format. Examples of written information may include what exactly happens before the onset of the seizure, like what exactly the person was doing that led to an event of seizure. What alerted you to the seizure? For example, if the patient was standing, if the patient had just gotten out of sleep, and what alerted to the seizure, as in if the patient had any aura, if he understood that now he's going to get a seizure, if the patient had any kind of jerks to begin with, and were there any unusual behaviors, and if there, for how long. For example, suddenly the patient starts talking something irrelevant. If there is any sudden change in the behavior at the onset of seizure, that also is very important to record. Did the person describe any unusual feelings, any unusual smell sensation or taste sensation, or any tingling in one part of the body, or a posturing of one part of the body? That is also important because that will localize your seizure to one particular area of your brain, and it will be easier to understand why you are getting seizures. Then what happened during the seizure, and since the beginning of the seizure to the end of the seizure? How long did that seizure event lasted? Was the patient conscious during the seizure? Was the patient not conscious, not aware? He was just in his own world. He does not remember what exactly happened. Did the patient become unconscious? These things are also important. Body movements like stiffening, jerking, then twitching. One side of the body, whether it was right or left or both the sides, it's very important to note that. Then how were the eyes during the seizure? Were they open? Were they shut? Were they uprolled? These things are important. Or were they deviated to one side? Then was the patient crying, laughing? What exactly emotional state was during the seizure is also important. Was the patient responsive to the questions asked by the bystanders? Was the patient unresponsive? Was the patient repeating a particular word? These things are also to be noted. Then was the breathing shallow? Was there no breathing at all? Did the patient go pale or blue? Was there any bowel, bladder incontinence? Or was there any tongue bite? These things are to be noted again. Then once the event stops, was the person immediately responsive up and about, or was the patient drowsy or unresponsive or confused for a while? If yes, then for how long? Did the person have difficulty breathing, speaking, walking, moving after that? Did the patient sleep after that? If yes, for how long? Then the return to the activity straight afterwards was there or not? Or if the patient showed any cognitive, behavioral, or emotional changes right after the seizure ended. And of course, if the patient has the accurate memory of the event of what exactly happened from the onset till the end. These are the things that the patient and the bystander should be noting and then informing your particular doctor. Then what actions were taken after the seizure or during the seizure? Was there any first aid applied? Was ambulance called? Or was the caregiver notified? Then doctor may also suggest tests to detect brain abnormalities. The most common tests prescribed are MRI of the brain and electroencephalography. The way ECG is done for heart, which is the electrocardiography, EEG is done for brain, which is electroencephalography. It records the brain rhythms and the electrical activity of your brain. The EEG may suggest a particular type of epilepsy, and based on that, the doctor may prescribe you a particular medicine. During this video, the EEG, some of the doctors may ask you to go for a video EEG in which the video is recorded of the event, and if at all the patient gets a seizure, the seizure is also recorded, and from which part of the brain the seizure is arising is also seen in that EEG. So these are some of the uses of EEG, video EEG. Recording the seizure may help the doctor determine what kind of seizures you're having or rule out other conditions. So this is how the description of epilepsy is, and I've tried and make it simple for you to understand what all is important. Epilepsy is not just jerking of the hands and the patient becoming unconscious and then drooling of saliva and then regaining after some amount of time, but it starts right from the time the patient starts feeling something to the time the patient comes back to normalcy. So these are the things that you should be noting in any kind of seizure, and you should be reporting it to your doctor. The most important thing is to understand where from the seizures are arising, and that is helped by a good history by the patient and as well as the bystander and the eyewitness, because once the seizure activity spreads throughout your brain and the seizure generalizes, the generalized seizure is same in all the patients. So the most important thing is the onset of the seizure, which starts with the feeling of uneasiness or the feeling that the patient is going to get a seizure. So this is the most important thing that you should be noticing, and if possible, also recording it in your phone and showing it to your doctor. Thank you.